Awesome. Great to see so many faces. If you're in the back, we can't really see people in the back. If you want to come up a little bit, feel free to do that. If not, I know that's a big ask, so not necessary. But first, I want to just welcome you all to our session, Helping Youth Address Public Health Problems. We are going to talk a bit today about how public health fits within STEM education during a time where public health is everywhere. Through the COVID-19 pandemic, the opioid misuse epidemic, bullying, racism, obesity, our youth today are faced with a lot of public health challenges, as are many adults as well. And so we're going to talk a little bit about public health and STEM education and skill development, and also encouragement of public health careers. We today are not going to be covering COVID-19 guidance related to schools or otherwise, but we do have an opportunity for you to email those questions to CDC info response at cdc.gov. And they will be able to answer those questions directly for you. So as we go through this session, feel free to do your questions through the South by Southwest EDU Go app. Again, you just go to our event and hit engage, and there'll be an opportunity for you to ask questions. We will do our best to answer those questions as we go through this session. So let's start with some introductions. My name is Kelly Cordeira. I am an epidemiologist at the Centers for Disease Control and Prevention. I work in the Division of Scientific Education and Professional Development, where I lead student programs and partnerships. This ranges from working with K-12 students and their teachers to introduce public health topics in the classroom, through working with medical and veterinary students to support them in experiential learning opportunities. I also support programming at the postdoctoral level, so our Epidemic Intelligence Service, which is our disease detectives. You may have heard them referred to. And I will talk just very briefly about my background. So I've been at CDC now for almost 9 years. Prior to that, I worked in public health in the nonprofit world. I actually worked in Austin, Texas for a few years, working with nonprofits to support youth in obesity prevention, primarily focused on nutrition, physical activity, and tobacco prevention. Prior to that, I also worked in Brazil, working in physical activity and public health, doing research in Brazil itself. And then prior to that, and I think that's really where I got my start in public health, was when I was a teacher. I was a middle school and high school math and science teacher. I taught life science, physical science, chemistry, honors biology, and pre-algebra, not all at the same time. That would be a little crazy. But throughout my time there, and that was really when I fell in love with public health. I really wanted to teach my students using scenarios and concepts that were engaging and interesting to them and that were impacting them on a daily basis. And so I had the opportunity, a great science department chair, to recreate different parts of my curriculum to support public health incorporation. And I didn't know it was public health at the time. I found that out later, and then sort of moved through the pathway of graduate school and all the way through my career and where I am today. So I will now turn it to Tessa, who has engaged with CDC quite a bit. She participates in our CDC Science Ambassador Fellowship, and this is for middle and high school teachers who are interested in teaching public health. And Tessa has been really integral in bringing public health into her classroom. Tessa?
Hi, I'm Tessa Spraetz. I am a high school science teacher at Rosemount High School, which is in Rosemount, Minnesota, which is a suburb of Minneapolis. I have been in that high school for 4 years, and this is my 19th year of teaching overall. And my classes that I teach, I am involved with CIS, College in the Schools Physiology, which is a concurrent enrollment class offered with the University of Minnesota. I also teach on-level biology, and I have a brand new infectious disease and public health course, which I just am wrapping up our inaugural trimester just this week. And then prior to being a teacher, I worked as a paramedic for 10 years. And so that was really my first introduction into public health. but it was my involvement with the Science Ambassador Fellowship that really sparked my interest and my love for public health, and why I'm passing that on to my students and helping them to get this spark and this interest in public health.
Thank you, Tessa. Also with me, I have Victoria Phifer. She just recently served as our Health Equity Officer for our center, so Centers for Disease Control and Prevention. She is within the Center for Surveillance, Epidemiology, and Laboratory Sciences. Victoria?
Thanks, Kelly, and good afternoon, everyone. I'm really thrilled that you all have chosen to stop by our session. As Kelly mentioned, I serve as our center's Health Equity Officer, and I wake up every day excited and passionate about the work that I do that's at the intersection of public health, policy, and social justice. And that's really critical now more than ever. I get the opportunity to collaborate with Kelly and many others who are doing really important work in our center, making sure that we have a public health workforce now and in the future that represents the communities that we serve. I've been in public health for almost 10 years and at CDC for the last 6 years. And I'm really excited to be a part of this conversation this afternoon. Thanks.
Great. Thank you, Victoria. So to get us started, I'm going to talk a little bit about STEM at CDC and what we're all about and some of our offerings. That will lay a nice foundation for the discussion that we're going to have today. So STEM at CDC is something that we've been working toward for a while now. We've had a lot of programs over the last decades to support STEM. However, most recently in 2019, we put together a website of all of our materials and resources and have been finding ways to build and develop upon those for teachers and for educators to support them in the classroom. Our goal really is to support teachers, to support students of all ages and of all backgrounds to be inspired by public health, whether that be to become more knowledgeable about public health or for that to become engaged in public health and to pursue careers in public health. I'm going to start off with a video from our current CDC director, Dr. Rochelle Walensky, who will really, I think, highlight where STEM at CDC is and where it's going. And so I will turn it over to the back for the video. The first video, please.
Welcome to STEM at CDC. Here you will find resources for everyone, from teachers and students to those considering a career in public health. Public health is about using science and data to protect everyone and every community from health threats. In short, it is the science of helping people. And CDC is the world's premier public health agency, charged with preventing disease, prolonging health, and saving lives. Here at CDC, we have almost 170 different job categories that draw on the academic disciplines of science, technology, engineering, and mathematics, making STEM an essential part of CDC's work to protect the health of people and communities here and across the world. Talk to someone who works at CDC and you might meet a scientist identifying new pathogens in laboratories, an epidemiologist, also sometimes called a disease detective, racing to find the source of a disease outbreak, an informatician visualizing billions of data points, a communicator crafting vital public health messages, or an engineer understanding how built environments, from stairways to highways, can affect our health. We are in a new era in public health, and CDC needs skilled, diverse, and educated people from all backgrounds to join us in our public health scientific mission. You never know where your path might lead you as you discover doors to careers never imagined. My own educational background in biochemistry and molecular biology, and then later in medicine, prepared me well for a future in public health. Whether you are a teacher, educator, student, public health professional, partner, policymaker, communicator, or someone who is just curious about our work at CDC, I hope you'll find this site and its resources helpful on your STEM journey. We are excited to welcome the next generation of STEM learners to public health.
Thank you. So just to talk a little bit about the types of resources that we have at the agency to support students, we are going to break it down into 3 different categories. So for students, we have a variety of resources. We have fun mobile apps. We have comic series for them. And then we also have some great opportunities for them to be in person. So there is the CDC Museum Disease Detective Camp, where students have the opportunity to role play disease detectives and solve an outbreak like they would in real life. We also have an online version of that, the Public Health Academy, and that's all available through the CDC Museum. We also have resources for teachers. So for example, we have educational activities and lesson plans available. We also have the CDC Science Ambassador Fellowship to support teachers interested in public health. That involves professional development opportunities at the agency, as well as opportunities for regional trainings across the United States and major US cities. We also have some great resources for college students. So as students sort of progress into their career pathways, we have opportunities for college students and in-career professionals as well. So the website also provides some great context that we're gonna talk about quite a bit today. So we have why should public health be part of STEM education? For students, we have some opportunities for them to see themselves in public health careers. And then we also talk quite a bit about how CDC is building an inclusive STEM workforce, as well as who we partner with to support that work. Today, we also just want to quickly highlight our newest STEM resource. We have the CDC Nerd Academy, which is a brand new public health curriculum available for teachers. It helps students answer key questions they may have been asking about COVID-19, such as what exactly is a pandemic? How does disease spread? Why do laboratory testing? Each of these questions is answered in a module. There's great STEM lesson plans that are comprehensive. They have student answers, student worksheets and answer keys for teachers. And then they also have educational videos for students, demonstration videos for teachers, and career spotlights as well. So just to quickly intro that project, we're gonna show one more video before we jump to our discussion. So play the second video, please.
Today's students face many personal challenges related to public health, like opioid misuse, obesity, bullying, racism, outbreaks, and even a pandemic. Students are becoming more interested in learning about public health issues, and we can help them apply critical thinking skills to address real-world issues. Middle and high school STEM educators are uniquely positioned to inspire students and influence the future of public health. Early engagement is key to spark students' interest in public health careers. The CDC Nerd Academy is an innovative and standards-based curriculum that covers basic concepts in public health and epidemiology. Student activities are centered around a novel emerging respiratory disease, or NERD for short. Although NERD is fictional, the science is not. This timely and relevant curriculum is built upon data collected during the COVID-19 pandemic and is presented in age-appropriate, relatable scenarios. The curriculum's 8 modules are aligned with the National Health Education Standards and Next Generation Science Standards and designed with input from STEM teachers and subject matter experts. The curriculum includes modules that can be downloaded and used sequentially in a comprehensive series, reordered, or used as standalone lessons. Students will learn to answer critical questions such as, how does disease spread? Who is at risk? Why do laboratory testing? And more. Each module features an all-inclusive lesson plan, engaging instructional videos, and a public health career spotlight. A 2-minute teacher video demonstrates how to implement student activities. A 10-minute student video with whiteboard animation activates student learning. A career spotlight that brings to life relatable and diverse characters, each highlighting specific jobs in public health. We are calling on STEM educators and partners to help get this curriculum into middle and high school classrooms. Please use and share this educational curriculum to inspire students, to help them make more informed public health decisions for themselves and their communities, and to open doors to a world of careers in public health. Learn more and get the CDC Nerd Academy curriculum at bit.ly/CDC Nerd Academy.
Great. Okay. So now that we just have a quick foundation of what STEM at CDC is and the types of resources we have available, let's start with a question to Tessa. So Tessa, can you talk a little bit about why it was so important to you and your students to incorporate public health into your classroom curricula?
Sure. Incorporating public health into the classroom really became something I noticed, especially in my students with what we're dealing with right now, with the current pandemic. Students just becoming more aware of what's going on in their lives and wanting to learn more about public health. And the spark that I've felt for public health, I really wanted to pass that on to my students. I really firmly believe had I learned about public health in high school, I would have gone down a completely different path. I love teaching, but this has really been a really interesting information that I want to pass on that spark to my students. And STEM education has so many important concepts that are important to students and their future learning. Things like being creative and having curiosity. Curiosity is really the basis of science, and public health is the science of people helping people. And so getting students this ability to have problem-solving skills and to ask questions and to work with each other, I feel is a really important part of public health curriculum, and I wanted to develop that in my students.
Thank you, Tessa. So I think that's really important, and it's something that you heard Dr. Walensky say as well. You know, public health really is the science of helping people. It's not just about preventing and controlling disease outbreaks. There's so many different aspects to public health that support so many different disciplines. There's science and there's math and there's technology and engineering, as we would assume because we're here talking about STEM, but there's so much more. There's communication and there's policy and there's ethics and public relations, and there's just this broad range of different disciplines that go into public health, and that really supports such a wide range of professionals to be part of public health and to be a part of that collaborative team to make public health what it is today. And it's all dynamic, and so I think that's really what's telling about public health is that it's so dynamic. It requires so many different skill sets and so many different peoples from all different backgrounds to make public health work. And to me, I think simulating that in the classroom is just something that's so critical for students to not only to be able to see themselves and practice these skills, but also to spark interest above and beyond STEM as well. Not every student is going to go into a STEM career, and that's okay. And I think with public health, there's lots of opportunities for them to see possibilities of other careers as well. So thank you for that response. So Tessa, before we move on to talking a little bit more about careers, what types of other resources do you think teachers could use in the classroom to support teaching public health in their STEM curricula?
Yeah, great question. I feel like what's most helpful to teachers is having ready-to-use activities. As you saw in the video, having access to how do you do the lesson, what are students going to learn, having the answer keys, but having that background information so you can go into the topic being confident in teaching the information. And myself knowing, okay, if teachers have tried this and teachers have developed it, that means this is going to be successful in my classroom, and my students are going to find success with it, and they're going to find that personal connection to help them learn the content material better and to better understand it. And I think, as you touched on as well, having more information about careers in public health, because students know what are doctors, what are nurses, but they might not know what an epidemiologist is, and how do I get STEM skills to help myself in future public careers?
Yeah, so certainly, and we talk, about literacy and students really understanding the public health content and the science and the math behind it. And then we also talk quite a bit about careers as well. And so one piece that I want to add is, it also really supports diversity and inclusion in STEM as well. And so, Victoria, I think this is a great point for you to add on to here with your background. Can you talk a little bit about how public health and STEM education can support diversity and inclusion in the workforce?
Absolutely, it's a great question. First, just with some level setting, I think it's important to just define some definitions. So when we talk about diversity, we're talking about a respect for and appreciation of our individual similarities and differences. And there are multiple dimensions of diversity. And when we think about nation of origin, religion, gender identity, sexual orientation, those are all important. But when we build on that and think about inclusion, it's about creating an environment where people can be and feel welcomed and appreciated for those differences and similarities. So in the workplace, I think, unique attributes that we bring from our lived experience, culture, competencies are all important, because in the work that we do at CDC and other public health agencies, we need all of those unique journeys and experiences and skills. We can't run, an agency like ours with all epidemiologists or all community health workers or laboratory scientists, but it's the convergence of all of those unique backgrounds and skills that makes our work work. I think when we think about the work of the future, we're going to increasingly depend on a workforce that has, familiarity with the skills that you've talked about that come up in STEM. So creativity, innovation, critical thinking, design thinking, and problem solving are all really critical. And so we do a lot of work to try to broaden the scope and exposure of students who learn about and are excited about public health.
Great, thank you, Victoria. So one really important aspect that we really want to think about here is, how are we actually reaching teachers, and how are we really reaching students? And so, we certainly have opportunities through partnerships and other organizations to reach students. How are we specifically reaching students who are underrepresented in the STEM workforce? How are we building a more diverse workforce? How are we promoting inclusion within our workforce to support the next generation coming through? And so we continually talk about new ways to intentionally partner and intentionally consider how we are working and networking with teachers and organizations to ensure that we are reaching students from all corners of the United States. So Victoria, I'll turn it to you. I know you also do quite a bit of partnership work as well at the agency. Can you talk a little bit about some of the partnerships that we already have, and then perhaps some of the partnerships that might be really beneficial to thinking about STEM at the agency and beyond?
Absolutely, yeah. So I think something that's really exciting that's happening at CDC, launched last year, is a major new initiative. It's called the Core Health Equity Science and Intervention Strategy, or CORE for short. We love acronyms. And what is great about this initiative is that it's an agency-wide initiative to center our work in equity. And it touches every corner, every facet of the agency. So we've got a lot of goals that are centered around making sure equity is a part of our science, our interventions, our partnership work, and also that we're taking a concerted effort to advance equity within our own internal workforce. I mentioned CORE because partnerships are a key pillar of that strategy, and we do a lot of cross-sectional and cross-sectoral partnership work. So we work in the academic setting with governmental organizations and non-governmental organizations. I can highlight a few examples. So with the academic partners, Kelly mentioned the CDC Museum earlier. The museum does a lot of great work and outreach to high schools across the country, and making sure that in instances where there are students with interest, that they may have an opportunity to have an internship placement in CDC programs of interest. We also have a large-scale grant-funded partnership with several professional associations in the medical, nursing, and public health sectors. And that grant program is largely centered around improving the health of individuals and communities across the U.S. They do a lot of training and webinars and events to talk about public health. We also have public and private partnerships, and so that's really critical. But there's a lot of emerging partnerships that are developing that we're really excited about. In our center, we've started to build some relationships with really key professional associations and groups that represent, for example, minority-serving institutions, and making sure, because many of them have schools or programs of public health, that they see CDC and public health as a viable career option or place to start their career, that they know about the great fellowships and training programs that we have to offer, and that where there are opportunities, we might be able to partner on research or other exchange programs. So those are just a few examples.
Great, thank you. Yeah, so there's a lot of emerging partnerships that are coming to be that we're very excited about at the federal level within the agency, across agencies, and then also with some of the bigger and larger organizations that support public health and support STEM education and education in general. So I want to kind of turn it around a little bit. So that tends to be a little bit sort of like the top level of how we're kind of integrating organizations and working together, but there's also the need to reach teachers directly, sort of that grassroots, bottom-up approach. And so Tessa, do you want to talk a little bit about how we're doing that, perhaps through the Science Ambassador Program, but then also just thinking about what some other ways could be that we might reach teachers at that level?
Sure. So I can start with the Science Ambassador Fellowship Program, which is something that I got to be a part of in 2019. And the really interesting thing about the fellowship is it's a collaboration of teachers from across the United States. And we get together and we get to develop lesson plans and activities. And so these are ones that you can find on the Science Ambassador Fellowship that are able to be used by all teachers. And we might talk about that in a little bit as well. Just another aspect that for teachers to reach out to their local and state health departments, whether it's their county health, whether it's, so speaking for Minnesota, I can access a lot of information from the Minnesota Department of Health. For example, just this past week I had my students, we were talking about the opioid epidemic, and the Minnesota Department of Health has ongoing information about rates of opioid overdoses and races affected by overdose deaths. And so having the students look at not only this data for Minnesota, but also for Dakota County as well, giving that relevant tie to this is what's going on in my neighborhood. And then reaching out to universities as well. The University of Minnesota houses a public health department. It also houses CIDRAP, Centers for Infectious Disease Research and Policies, which is headed by Dr. Michael Olsterholm. And so it's a lot of great resources and topics that are very easy to access. And a lot of universities are starting to open up to field trips again. And so students are getting the chance to see what it's like to be on a college campus or to meet what does a researcher do. What might this look like if I go into this field? So it's really sparking that interest in kids and these students. And then also reaching out on social media. With the release of the Nerd Academy, that's been released on Twitter and Instagram and Facebook and LinkedIn. So getting the word out to other teachers that, hey, we have these great resources that are now available for you to implement in your classroom.
Great, thank you, Tessa. And one thing I want to mention about what Tessa just mentioned is really the connecting in with state and local health departments. State and local health departments are an incredible resource for teachers. Public health really belongs to the states, legally through the 10th Amendment, but also functionally. They are doing a lot of the work, and they are really engaged in the community, and they know what's happening in communities. And so from a teacher standpoint, it really provides this great opportunity to connect students with what's happening around them in public health. So as mentioned earlier, we are in a time where public health is everywhere. The global pandemic, opioid misuse, bullying, racism, we hear it everywhere and we hear it in the news. But it's the state and local health departments that are going to be able to tell you updates from your state level and your local level that can really help students relate to what's happening in public health themselves. And so one story that I really like to tell, there's a a teacher who came through the Science Ambassador program, and he works in rural Missouri. And he did just this. He was developing a brand new biology class for his high school students, and he was looking for resources on how to best get the students to relate to the content and really understand the foundational science, biology behind what was going on. And what he did is he reached out to his local health department and he said, what are the biggest issues we are facing in our community and how can I teach my students about this? And ultimately, they ended up creating this amazing course for students where the students not only learned the foundational science that they needed to pass the course and graduate, but they also created ways to become involved in their community. They ended up creating, they ended up focusing in on mental health for one of their projects, and they ended up creating a mental health curriculum for the students within their school. And it was their way of making public health actionable. And not only did they do and implement this public health curriculum in the school, 6 other local schools picked up the project and created their own versions of it. And it was really telling to me in doing this through his eyes that there's just so much opportunity for students to get involved and to not necessarily, sit in front of a textbook to learn this content, but really do it and inspire them to see that they can make a difference in their communities and then perhaps make a difference in their future careers as well. So I'm actually going to turn it back to Tessa again. So the Science Ambassador Fellowship is a really fantastic program. We bring in quite a few teachers every year. And what we do is we connect teachers to experts across the agency with all different backgrounds and all different expertise. And we bring them together to sort of train each other in how to do this and how to teach public health as part of STEM education. And they develop lesson plans together, essentially. Tessa, from your perspective, can you tell me a little bit about how it felt to engage with public health experts to create this content? And then sort of from the flip side, what the value of that is when you see materials that are available to you that were co-developed by both public health experts in that particular field that the lesson plan's focused on, but also by teachers who are experts in STEM and STEM pedagogy.
Yeah, I certainly address that. So the Science Ambassador Fellowship, like we've been talking about, we develop lesson plans and activities with other teachers. And being able to work with other teachers from different backgrounds and different groups of students that they work with, everybody brings in a different perspective, which is really helpful when you're creating lesson plans. And one of the really unique things about the fellowship was you get to work side by side with CDC experts. And one of the things that I really took away from this was when we were working with these experts, we were working one-on-one with them. And the feedback we were getting from them, we knew that the data we were going to use was valid and it was relevant. The activity that I worked on with my group, we were looking at a foodborne outbreak. And so the activity we developed was based on an actual foodborne outbreak. We used actual case counts in our data. And so again, getting back to that student personal connection, knowing that my students are going to see, hey, this was a real thing that happened. This was a real incident. Real people got sick. We could trace it back to a certain food source. That was the highlight for me, was working with these experts and knowing the activity I was going to develop would be fact-based, and knowing that that activity, when it's published along with the other ones, all the other activities are fact-based and relevant, and the students are going to be able to come away from that activity knowing that this is a real thing that happened, and they can find real importance in what they're learning and get that spark that we keep talking about, and learn and be creative and ask questions. And so that's really been the highlight for me, was using these teacher-vetted activities and knowing that it worked for these teachers, it's going to work for me. And that gives me confidence to try something new, which as teachers, you don't want an activity to fail. Knowing that it's been tried has been really helpful for me.
So Tessa, I'm going to push a little bit on this question for you. So what else could be done to bring even more credibility to these resources that organizations like us and others can provide for teachers to ensure their credibility?
Yeah, great question. And it really comes down to that, the teachers trying it in the classroom and getting that feedback. All the activities that we've done that are posted on the Science Ambassador Fellowship website, we've tried them. And the feedback that's given has been turned back in and helped to edit the activities so by the time they're published, they're accurate and they're valid. And really reaching out to teachers, again, getting that confidence and making sure that they know, okay, you can do this, this is going to work well, and being able to access the Science Ambassador email where if we did have questions, we could reach out and say, hey, can you have a little helpful feedback on this? What can we do to improve on this activity? Or just reaching out to the teacher network. That's been really helpful as well.
Great, thank you. So Tessa brings up a good point in terms of accessibility to the content. And so we really think about when we're building content, you know, we really want to dive into, you know, diversity, equity, inclusion, accessibility, DEIA. I'm sure you've heard that over and over and over again. And it's more than a buzzword, right? So we really want to think about this intentionally. So we talked a lot about, you know, how are we reaching teachers so that we're able to reach teachers who can then reach students from all different backgrounds across the United States. But that's not enough. It's not enough just to reach them, right? It's really thinking about how are we making this accessible to all students? And so we can interpret that in a lot of different ways. So we can think about, you know, how are we making content available and accessible to low vision learners? How are we making it accessible to students where English is not their first language? And so taking some of the considerations to ensure that different students can also engage with this content is really important. I also want to talk a little bit about, we did this with the CDC Nerd Academy project, and we were really trying to be intentional and thoughtful about how we developed out the scenarios and the characters that we built into this project. So you saw the promo video that we played earlier. There's really cool educational videos that go with each of these modules, each of the 8 modules. And within each of the 8 modules, we introduce a character, or multiple characters really, but we highlight one particular character. So we have 7 characters throughout. And as we were developing this, we actually recruited a group of 7th grade students to develop these characters for us. So they actually picked, you know, how tall they were, their race, their ethnicity, what they looked like, all the way down to what their haircut looked like, and their clothes were. And it was so eye-opening. It was incredible. They ended up coming out with this incredibly diverse group of professionals, both in job category, in race, ethnicity, and in backgrounds. They created backstories for each of these characters. It was absolutely incredible. And so we learned from them and we ran with it. So we were really thoughtful to incorporate in our scenarios and in our examples, we retained that cultural diversity for each of these characters so that we really could reach students and more students could see themselves in these roles from all different backgrounds. And this was something that we became really passionate about as we started developing it out, and it's something that we really are trying to carry through all of our materials. It's not just reaching students, it's really finding a way to connect with students so that they feel included and they feel like they can see themselves. It's about opening doors and providing the support and mentorship to walk through that door so that they're not intimidated. And so I'm gonna stop there, and I'm gonna pass it to Victoria here because we're kind of at the point in the conversation where we've gotten students interested from all different backgrounds, right? And we've kind of opened that door. Victoria, can you talk about how we are going to shuttle these students and make that connection from the K-12 world and connect them with careers for the future?
Sure, that's so important. We've highlighted a lot of the great resources K through 12 that are available, but thinking about their life afterwards is so important, and making sure that the spark that we've generated is sustained and contributes to, like we said, building and sustaining the public health workforce of the future is critical. I think we can do this best by highlighting a few of the fellowship and training programs that are offered at the agency. Kelly, I think, highlighted earlier, we've got like over 60 different training, leadership development, internship programs at the agency. They range from all types of disciplines, from laboratory science-based programs to informatics, data science, policy, it continues. And so one of the first that I think is really exciting and is brand new is Public Health AmeriCorps. So CDC and AmeriCorps have recently partnered to launch this brand new program. It's a grant program funded by our agency over the next 5 years that's designed to really build, train, and sustain the public health workforce of the future. We know that public health has been pretty chronically underfunded, and numbers of folks in the field have declined, so we know we've got to build those numbers. I think Public Health AmeriCorps is especially important because its two main goals are, one, to support local public health, making sure that we understand the unique context and issues of local communities, and that they get the state and local support that they need to address those issues, particularly related to health equity and underserved or under-resourced communities. And its second goal is actually focused on career paths and making sure that students who are interested in public health have clear career paths into sustainable careers in the field. So they'll do this by having curricula that's designed to help them build all of the essential skills that they'll need in leadership development. And I think this is going to be really important because AmeriCorps has had AmeriCorps members who have served in public health settings in the past, and that will continue going forward. The next program I'll highlight is CDC's Undergraduate Public Health Scholars Program. We call it CUPS. And this is a really great program. It's a summer 5-week intensive kind of enrichment program. CDC works with 5 different university or other partners, including Morehouse School of Medicine, based in Atlanta, Georgia, and Columbia University as a few examples. Each of those partners develops curricula and programming to really inspire students and also to give them the hands-on and experiential experiences that they need to learn about data and surveillance and health equity as well. And the last program I can highlight for now is CDC's Public Health Associate Program. We call it PHAP. And it's a really phenomenal 2-year experiential experience. It matches students in various host sites across the country. So whether they're in a state, local, territorial, or other type of public health agency, they may be at an academic setting or in a nonprofit organization, they get the tangible skills that they need over 2 years to really understand frontline public health. All 3 of those programs that I've just highlighted are really committed to and focused on expanding not only our reach, but demographic representation in the field. And I'd say all of the programs at our agency are really taking a closer look at making sure, like Kelly said, we're not only expanding access and awareness to these programs, but that we're really intentionally designing the curricula and the focus of the programs as well.
Great, thank you, Victoria. So we have some really great events coming up that we'll just talk a little bit about because I think it's a nice connection to how we're working in STEM education to support women in STEM. And so March is Women History Month. You probably already know this, and tomorrow is International Women's Day. So Victoria, do you want to talk a little bit about how we're supporting those events?
Well, I can definitely talk about how we're supporting women in STEM and public
sure.
health in
that
particular.
Works too.
Yeah.
Great.
We know that there's a lot of variation and representation in the field of STEM. There are some disciplines where you might see, large representation of women, and some disciplines like computer science where maybe women are underrepresented. But public health is actually a field where there are many women in leadership, and both we see this at the federal level, at the state level, and we want to encourage young women who are interested in STEM fields like public health to seek out careers in the field. You saw the video earlier from our agency's director, Dr. Rochelle Walensky, who's had a long career in this field. She's committed to inspiring young women to explore careers in this field. It's important to see representation, I think, from a young age. Dr. Walensky is, I think, the third woman in our agency's history to lead the agency. I'm excited for the role that she plays. And I think the work that we're doing with partners will continue to expand our reach to make sure that students in every community in the country learn about public health and STEM careers, and maybe you might highlight some of the upcoming events and activities that are coming up.
Sure, I'd love to, and I'm actually going to add on a little bit to what Victoria was mentioning before. I think there's really some cool statistics in public health that really are a little bit different than what's happening in the world of STEM. So in the STEM workforce, we don't necessarily see the same percentages of women in STEM as we do in the public health workforce. The public health workforce is about 60 to 70% women, which is an incredibly high number compared to, or high percentage, I should say, compared to some of the other STEM fields. When you start breaking that down a little bit, the numbers are not as good. So we're about 50% for women who are epidemiologists, and the number drops even a little bit more to about 30% of women in leadership roles. And that's really across the board. Victoria kind of broke it down by federal and state and local. So there's still some work to do. There's some work to do when it comes to diversity in women in public health as well. Unfortunately, the number drops to about 40% or so of non-white women when we break it down into race, ethnicity. So definitely still some work to do, but it is really promising. We've had a lot of great women in public health, including our current CDC director, who was brought in during the pandemic to really, during this very challenging and time in public health, where public health is truly in the limelight. And so it's really incredible that she was able to sort of take the reins and go with it as we move through this very challenging and historical time in public health. So I'm going to just start talking a little bit about some of the, I know I can ramble, I'm going to start talking a little bit about some of the upcoming things that we have going on with CDC and how you can engage with those. So earlier we previewed the CDC Nerd Academy project. We have 2 modules that are readily available now if you're interested in checking those out. They're all on the CDC website, so cdc.gov. That one is cdc.gov/Science Ambassador, which is the program, and then Nerd Academy, which is the curriculum that we have available. In the coming weeks, we are going to be releasing the remaining 6 modules for that particular project, and then starting to, with no breaks, starting to look toward providing some translations for that particular project, as well as starting to think forward in what other types of curricula and lessons and activities we can provide to support teachers across the country. We also have some great offerings coming up. So obviously, like many of you, we have been virtual for the last 2 years, and we're hopeful that we will be able to go back in person for teacher trainings and for student camps. So as of right now, we are hoping to start back with doing in-person teacher trainings, which are readily available. Those all are also available on the website. So for that one, cdc.gov/Science Ambassador, you can find information about the fellowship and regional trainings. For your students who are interested, CDC Museum is also opening their doors. They are opening officially to the public in May, and then their CDC Museum Disease Detective Camp for students is opening for the summer. They'll offer 3 different opportunities for students from across the country to come to the agency and learn public health. So we are very excited to finally be going back to some in-person training and opportunities for teachers and students. Looking forward, we also have more resources coming about from across the agency. As I mentioned, we are really trying to support STEM at CDC through both internal and external partnerships. We are working with groups across the agency to provide more resources. And this ranges from Teen Talks, which is provided by the CDC Museum. Every month they pick a topic and they bring in some subject matter experts. Students can read sort of the one-page fact sheet, and then they have a webinar where live you can listen to public health experts talk about that particular project. This ranges from also more opportunities for different experts to participate. So we're looking to create some really cool videos for careers. So we'll have some public health professionals talking about what they do on a daily basis, so that you can provide those to your students as kind of like a guest speaker in the classroom. We also are looking to, we're doing more and more how-to videos, so really thinking about things that teachers might need. So for example, how to take data and turn it into a lesson plan. And so we're trying to create some of those, what we call them job aids, but they're really kind of like how-tos to really start thinking about how we might be able to create more content and provide more support for teachers and educators across the board. As Victoria mentioned, we are also looking for partnerships. We are partnering again at the federal level, trying to incorporate into some of the work being done across all the federal agencies, as well as with nonprofit organizations, public-private partnerships, and then most importantly, at least I think in terms of developing the content, really connecting in with teachers and utilizing these networks in a way that are thoughtful and are going to best support teachers in any way that we can. So I will pause there. Victoria or Tessa, do you have anything to add before we close out?
You covered, I think, a lot of the pieces in a really great way that I would have highlighted, but I really encourage folks to engage with the content. We want feedback and want to hear your thoughts. I highly encourage you to check out, particularly like the Nerd Academy content that Kelly has mentioned and that we've highlighted today. I think that it's going to be a really great way to help people to understand what it is that public health does. So we'd love to hear more about your thoughts. So that's all I have for now.
Yeah, I'd like to piggyback on both what Victoria and Kelly talked about with accessing that Nerd Academy, just being willing to try something new. This is teacher-backed, teacher-vetted experiences and activities that will be successful, and our students want to learn more about what's going on in our world, and the Nerd Academy is a great way to introduce that to them in a not terrifying manner. They're not doing a ton of data work. They can interpret it. They can grab that data and say, wow, this applies to my life. This is something I can do. And getting that accessibility to all students, showing the career paths, that's huge. What are these options for me? And like Kelly had talked about, not everybody is going to go into the public health, but these STEM skills are lifelong skills. Being curious, asking questions, collaborating, soft skills. As we said, the science of public health is the science of people helping people. And what can we do to help our students help other people, I feel is a really good takeaway from what we're doing in science and in STEM.
Thank you. Those are perfect closing remarks for our session. And I will add that, public health is dynamic, and this whole process is dynamic for us as we start thinking about STEM at CDC, and we want feedback. Yes, we are experts in public health, but we are not necessarily the experts in STEM pedagogy and how to teach this content in the classroom. We truly rely on our teachers and our educators who are supporting this work, and we want that feedback. We need you to help us think about how we can build this content, how we can make it meaningful for students, and how we can make the right connections to teachers and to partners to do it. So with that, I will close out our session by thanking all of you for joining us today. We appreciate your time, and we look forward to hearing from all of you in the future. Thank you so much.